All right, it's Monday. Hopefully, all of you had a safe and happy holiday weekend. It means some changes in the numbers that we break down here for you every single day on coronavirus inside the Arizona numbers. So we'll walk you through some of the things that would be most accurate from the weekend, and then some of those things that we'll have to wait a bit longer to look at the numbers based on what comes in tomorrow after we have a full day of true reporting back in, because everybody's back at work to sort of count the cases and count the numbers, if you will. For those of you who are just joining us for the very first time, we're here every afternoon and we kind of break down some of the data that comes in to help you better understand it. We're happy to answer questions about where to find specific data. Just leave them in the comments there and we'll get to them. We'll help you find them so you can make the best choices for your family. Our job is not to interpret this for how you live your life and how you run your family, but to simply help you find the numbers you're looking for so that you all can make the best choices in all of this. My name's Katie Rammel. Alongside me here, I always point the wrong way. Garrett, there you are. Garrett Archer, our data guru. He dives into the numbers all the time for us, and we've been reporting on coronavirus since January 17th, and we know that this has personally affected a lot of your lives, and so there's not a life or an industry that has gone untouched in this. So we have great respect for that, and we want to help you work through that. But Garrett, the numbers that came out today, we passed an important threshold that we want to make note of more than 100,000 cases here in Arizona, which is one of the numbers we passed over the weekend. Obviously, the numbers on the weekend come in a little bit slower, and on a holiday weekend, probably even slower, if you will. How did things look over the weekend?
Hi. Okay. Yes. The as you mentioned, we did cross the milestone of 100,000 cases. 101,441 was the actual number. Now, this is important to know that this is the cumulative number of cases since reporting began back in March. So while I know we talk about that we don't have a recovery number, the likelihood is of these 101,000. A good portion of these are not active cases any longer because a lot of them came more than a month ago. Now, that being said, that is still the cumulative number. We did cross 100,000. We added 3,352 cases today, which was about a 4% increase from the day before. And then we added one death. Now, I've noticed of all of the metrics that are most impacted by the weekend reporting lag, it is the death number. So while we've only had one death today, and I believe we had a very low number yesterday too, I'm looking to confirm that right now, that number will likely change. We had 4 deaths yesterday. Those numbers...
Tomorrow could be a little bit shocking for people if they're looking at that number of deaths. And so we have to keep in mind that it's better to look, or it's safer to look at those numbers over the span of, say, a week to compare.
Yes, so, and that's exactly right. Tomorrow's number will be, especially on the death number, is going to be more reflective of what actually occurred on the weekend. So we simply don't know right now what did occur vis-a-vis deaths. And we had about 13,500 diagnostic tests reported today, which is a good number. It's not anywhere near a record, but it is still a good number. That gives us a percent positive of the diagnostic tests of about 25%. So about 1 in 4. Still a very, very high number that everyone's sort of looking to get down as quickly as possible.
Yeah. I was going to jump into this a little bit later, but it's something that I've heard so much about recently since we were talking about those numbers of deaths. Now, what we're seeing across the U.S. in the numbers of deaths is different than what we're seeing here in Arizona. We're still seeing more and more numbers come in, while places like New York maybe are not reporting as many. I believe you might know the name of the paradox that I'm speaking of, but where people sort of look at the numbers and they see, well, across the U.S. it's declining. It's not the same story that we're necessarily seeing here in Arizona, and that's why it's still such a concern in these states like Florida and Arizona that are so hard hit by this.
Yeah, the name of the paradox escapes me at this very moment as well. However, what you're talking about is when you roll up numbers from, I mean, that's when you look and say, oh, deaths are down across the U.S., you're assuming that the distribution of coronavirus across the U.S. is equal. And we obviously know that's not the case right now. We have areas that were very hard hit in the East Coast that are slowing down considerably, and the cases that we got here in Arizona are picking up. But we don't have the same, obviously population as Arizona does. And on top of that, it's a different sort of infection spread than what they had in New York. So, however, that being said, our numbers are still increasing, our hospitalizations are still increasing, and our deaths are still increasing on a weekly basis. Excuse me. But so you can't look at the US and say, oh, deaths are down, and presume that that's the number that applies to Arizona and Florida. It just simply doesn't.
Right. That's one of the big things that I've seen kind of posted around the internet that isn't matching. And one of the places for you that are looking for a graph that corresponds to that, on covidtracking.com, you can see the US graph that's on there. There's also a pull down menu, and you'll be able to see where Arizona ranks in all of this. So you can slide all the way over to the farthest part of Arizona's posting there, and you'll be able to see how those things are changing. Really every day that site is updated.
Yes, this site is updated every day at around 3 o'clock our time. I'm going to share it really quick so that everyone knows what you're talking about. So this is the covidtracking.com. Actually, I know that our thing says covidtracking.com data/state Arizona, but this is actually slightly different. This is covidtracking.com/data/charts/US-daily-deaths. So, and this is what you're talking about. When you look at the aggregated number of deaths and the 7-day rolling average for the entire country, you can see that the death number is absolutely falling across the country. Now, if we take this and we go to, it's going to take me just a moment to get there, but we go to the state data.
And once again, this is on covidtracking.com for those of you who are looking for this site. He's going to the pull down menu for Arizona and see all the way over in the gray there. That is how our Arizona graph corresponds to the US graph that you just saw. So when people say the numbers of daily reported deaths are declining, it's the opposite of what we're seeing here in Arizona.
Yes, and as you can see with that line right now, it does show a slowing as of right now, but that also has a lot to do with the 3-day reporting the 3-day reporting lag from the weekend. So tomorrow and Wednesday, it's going to be very telling as to where we actually are. So as you can see, last week the AZDHS really surprised us with a death number of 88 last week, which was a record high, and most of that was not done, which is with what is called a data match. And why the difference, just to understand, when a data match number, which are these two on here, you can see we're done by data matches. They're very high numbers, but a lot of these, when you look at the actual curve, actual date of death, the numbers were folded in across the entire curve, farther back than what is typical. This last 88 one did not fall back as far as the others. So it just showed that while some of this was done by data match, the numbers were increasing.
All right, I want to get to a question from Susie Valdez, and we'll leave that same page up there because I know the answer is right on the page, or at least the best answer we can give you, Susie. And here's why. You're asking how many have recovered. There is no set definition of what recovery looks like. So recovery for one person could look very different for another person. Some would say, well, that's the date you are released from the hospital. Some will say that's the date you feel 100% better. Some would say that's the date you get a negative test. So there's no agreed upon definition for recovery. So since the best we have to go on is people being released from the hospital, those are the numbers that we find on this same COVID tracking website. So Susie, when you want to track it, that is the same site to go to, covidtracking.com, and you'll have a pull down bar again for Arizona. And at last week, the recovery numbers that they're describing on there, which again, hospitalization, discharge, was around 10,000. Have you checked it today, Garrett? Did you see?
Yeah, I actually just checked it while you were talking, and it's about 11,000 today. Okay. We actually had a record number of discharges today at about 475 discharges. So that comes to about 11,741. So almost 12,000 people over time have been released from the hospital. Now, again, the problem we have with the discharge definition is that basically the release of a bed is a discharge. So there are examples in which a discharge could be a transfer to an ICU, a discharge could be a death, a discharge could be a transfer to another hospital, and there could be multiple discharges per a single patient, where you have a patient going to the hospital, being released from the hospital, and then going back to the hospital. So that's why, while it is a proxy, an estimate, it's not a perfect number. And in fact, because of just the nature of this of coronavirus, the recovery number is likely much higher. I'm working with some epidemiologists to get a better estimate for recovery, but we're just not quite there yet.
Yeah, so we'll keep trying to get to some sort of number for you. But Susie, I hope that helps and that you're able to find those numbers as well. Once again, that's covidtracking.com. So you can look each day and be able to see the closest thing we have to it. And of course, when we get something that would be considered a little more accurate, we'll of course pass it along to you. We had to wait a long time just for those numbers to start coming up. I know we got a lot of emails asking about that. So hopefully that answers your question, Susie. One of the other things that we've been tracking very closely is a New York Times article that came out today, Garrett. And it's a closer look at how minorities are being disproportionately affected by coronavirus. What were you seeing as this relates to Arizona numbers?
Yeah, so just to give some background on what you're talking about, the New York Times actually sued the CDC to receive data on ethnicity of coronavirus cases. And so then they wrote a story about this today about how across the country, Hispanic, African American, Native American communities have been hit harder than white communities of coronavirus. And we actually already have that data because the state actually reports that data. So we had already had it. We had looked at it. What we found, and let me share my screen really quick. I'm going to show you some of the areas in which we already have data on that. This is, again, on the azdhs.gov dashboard. Pardon me, I've got a frog in my throat today.
I left my fan on in here.
Yeah. And so what you're seeing right here is COVID-19 cases by race ethnicity. So white non-Hispanic, and this is using census definitions of ethnicity. So white non-Hispanic is 15% of cases, Hispanic or Latino is 23% of cases, and Native American is 7% of cases. And what I'm going to do is I'm going to show you one other thing really quick. I'm going to stop sharing and go to one more screen. This is a very helpful site that I use constantly when I have to do census comparisons. Mm-hmm. This site is called censusreporter.org. One of the most useful sites for census data you're ever going to find. And what you can see here is the most recent ethnicity breakout for the state of Arizona, according to the American Community Survey 2018. And what you can see is that the white ethnicity makes up about 54% of Arizona, and then Hispanic makes up 32%. So when you take those two numbers and you compare them, and you look at how the Hispanic or Latino demographics in the case COVID-19 case by race ethnicity is so much higher than white non-Hispanic, it becomes evident that this group has been impacted at a higher rate than white non-Hispanic. Furthermore, we did some look at the zip codes, and using census zip code data, the top 10 zip codes that have the highest number of cases in Arizona right now are all majority Hispanic and quite majority Hispanic. We're talking in some cases 80%, 70% of the zip code residents are Hispanic.
Yeah, and also one of the reasons there has to be an increase in testing in those areas so that people do not have to wait. What we've been seeing across the country, they've been talking about what we're seeing here in Arizona, which is in some cases a 13-hour wait to get a test. That is absolutely ridiculous.
And a lot of that was in the Maryvale area, and that Maryvale specifically, those two zip codes, and I'm trying to get them right now, which I'm not looking at you, which are 85033, excuse me, just make sure I got the right one, 85033 and 85034. They've had some of the highest percentage of growth in the last couple days than any of the others. I mean, they've really shot up because of the testing that they've been doing in those zip codes over the last couple of weeks. We've had a 600% increase, or excuse me, a 136%, excuse me, I have to read my number again, 1,360% increase in Maryville 85033, and a 1,200% increase in the other zip code since April. So we're talking massive jumps in those zip codes as the testing is increased in those areas.
And are those jumps in positive case reporting, or is that jumps in tests taken?
So on zip codes, all I have is positive cases. That's the only thing that the AZDHS gives us. So we do not know the percent of positive cases because we don't have a test number for these zip codes. We only have case numbers.
Right. So anybody following along here and you want to check out your own zip code. Oh, Maria and I are thinking exactly alike right now. Maria's saying, my zip code. Yes. Let's get you some answers. I think she's putting that emoji because she might live in one of the zip codes we just talked about. But for those of you who might not live in Maria's zip code and you want to know how to check it, so easy to do, but if it might feel strange when you're clicking on this because it's going to take you to another site. That's entirely fine. Can you even share your screen there, Garrett?
I'm sharing your screen again. So azdhs.gov, that data dashboard that we talk about every single day, there's a little button right here called zip code. You push that, and then there's a little link right there that's going to take you outside of the dashboard to a new window. And what this is this is a map of Arizona. And here, this is where you can actually go into the zip codes, go over your area. I'm going to try to click on the Maryville one. I think it's, yep, I got it. And this is 85033, and that's, as you can see, 1,729 cases are being reported there right now. This, as you can see, the gradient goes only up to 250. So since this is the urban area of Phoenix, nearly all of these zip codes have over 250 cases. But as you scroll out into less populated areas, you can see that you're now in a situation where there's only 61 cases out here, but this is an extremely low populated area type thing. So you'll sort of see that there's sort of a correspondence between the color and the density of the zip code.
Yeah, Garrett, have you heard anything about this map possibly being updated so that we can see more of a variant in the colors now that Arizona's all red? I remember when this first started, there, you didn't see very many zip codes that were this red. Now it's less of a tool unless you are looking up your specific zip code because there's not any real variance in there.
So yeah, they've updated this. This is about the third update they've done with this 250.
Yeah.
And they sort of update it every month or so, maybe 2 months, and they increase that gradient. However, a lot of times when they increase the gradient, it only is useful for a couple weeks because, as our case growth is, as everyone knows, the case growth has increased so much that these numbers have just not, the colors have not kept up with the numbers. So I'm hoping that I have another map that I'm trying to finish that will have a better zip code gradient, and I'll hopefully have that published and produced here soon.
Yeah, so our numbers are constantly outpacing what they're able to update on there. Well, we look forward to your graphs on it as well, Garrett. One of the other things that I want to mention, something that you tweeted out today, which was sort of the per capita breakdown by age group. You put it out on Twitter, and if people are looking for your Twitter account, it is at Garrett_Archer, and you'll find tons of information there every single day, even over the weekend. Garrett, thank you for still updating these numbers for us in the weekend. But one of the things you did that you sort of overlaid the age groups so we all could have a better understanding of how COVID is affecting age groups here specifically in Arizona.
Yes, so I'm gonna set this up with a separate chart before we go to the chart you're referring to. So what I'm going to show you is what the cases have looked like on the age groups provided to us by the AZDHS. So just give me 1 second. I'm almost done. So this is I'm going to share my screen now. So this is the age group. This is the case breakdown of all of the age groups, raw case breakdown, not per capita, of the age groups since the very beginning. And as you can see, under 20, there's been a small increase. 45 to 54, a fairly moderate increase, a very moderate increase in over 65, and then just an incredibly large increase in the 20 to 44. As you can see, it's made up the vast majority of cases. In fact, one of them is so large, I have to redo the scaling because this one actually disappeared because it's higher than 2,500. So, this obviously shows that most of the case growth has happened in this age group. Now, what you were referring to, I'm going to stop sharing one more time and then go back to the what you're talking about is sometimes, because as you know, obviously, these are not equal age groups. There's 20 to 44 is that's 10 more years than most of these age groups. 45, 54, 10, 55, 64, 10, over 65. There's a lot of people in that age group as well, but it's not as many as 20 to 44. So this is a per capita per 100,000 in that age category of these breakdowns. So this kind of gets a better understanding of how these age groups have been impacted over time. So this is 20 to 44, and you can see that it's about it's a little over 2,000. And if you take this into a percentage, this is about 2%. So about 2% of the people in Arizona that are 20 to 44 have a confirmed case of COVID. And then here's the 45 to 54. Here's 55 to 64. This is, I have to change this. This is the dotted yellow, so I'm going to fix this. But this is over 65, and then right here is the under 20. So even though there's been a lot of case growth in some of these, you can see how, like under 20, for example, most of those are kids. Kids have been staying home. They don't have to work. They haven't been going to school, so they have not had nearly the impact on case growth that some of these other groups do that have been moving about the state, whether it be for recreation or work, but they've had to move around a lot more since the stay-at-home order was lifted. You told us between 20 and 44 years old, you said 2% of those cases? Yeah, it's about 2% or so, yeah. And what about the other numbers on some of those? Do those? Yeah, I'll have to go back and check on those, but I'll get it to you next time. Fascinating, fascinating. And they can get a closer look at that right now on Garrett's Twitter page as well. So you can get a closer look at that graph that he put together. Thank you also for putting that together, Garrett. We really appreciate that. One other thing we really wanted to get to, and so many questions are coming in. I'll just answer a lighthearted question very quickly. Jody was saying that we are safe in our homes as well. That is true. I'm in my 2-year-old son's bedroom that has been made over into a studio. That right there is where I anchor the evening news. I'm sitting on the floor in here. This is not fancy at all. Garrett, you look like you might actually have a home office, not a 2-year-old. I share it with, as you can see back there, I think there's a bunch of horses on that thing there. So this is also a playroom. Yeah, so that works. So this is where we are. Several people have been commenting on it. Yes, we are safe at home. Garrett, you're working from home full time. I work from home 3 days a week. In 2 days, I am in the station, socially distanced. It's very strange to be in the ABC 15 newsroom and have it be empty there, because for any of you on here who've been in the newsroom, it is a bustling, busy place, especially in the early afternoon. So it's quite a different feel. But I want to get to the hospitalization. So by the way, Jody, thank you for that, and everybody else that was in the discussion about where we are. So that's it. The hospitalizations. Something sort of strange is happening here that we're trying to get to the bottom of, but on Maricopa County's website, I believe it's on the county website, we're seeing a delay in hospitalizations by about 21 days. And we're kind of playing the game of telephone here, as the hospitals report it to Maricopa County and Maricopa County reports it to the state. You've sort of circumvented those numbers so that we can have a better look at the numbers sooner and faster, if you will. Walk us through the differences here, and then we'll talk about this lag. So yes, so the state and the counties report hospitalizations in two different formats. So I'll start with the state. So they give a hospitalization number by date. That is a graph that shows what they perceive as the number of people who are hospitalized at any given time, and that is updated over the course of time. And Maricopa County does the same thing. The other way that they do it is through something called EM Resource, which is an actual reporting tool that they use, that the hospital systems use to report the number of beds they have available, the total number of beds they have, and then also the number of beds and assets that are being used by either COVID-19 positive patients or probable COVID-19 patients. So they're able to break those numbers down for us too. We get a look at each of those. So what we do is, because that hospital system reporting is much faster, and because it's near real time, it's done every single day, and there's likely very few errors. There have been errors in it, but there's few errors. We rely more on that for hospitalizations than we do for the hospitalization curve. Let me show you what you're talking about as far as the hospitalization curve. This is the Maricopa County dashboard. So this is their hospitalization curve, and as you can see, the way Maricopa County does this, they show that when they gray out these numbers right here, they are telling you that we do not believe that these numbers are complete. We believe that there is going to be a significant number of hospitalizations added to this portion of the graph, so please don't look at these numbers and say, oh, hospitalizations are going down. At this point, when it gets to this dark gray and they add this 12-day period average, what they're saying here is, okay, these are stable enough numbers that you can look at these and say hospitalizations until June 15th were increasing. But after June 15th, they're saying, we're doing an investigative process to add these numbers to our system, and we've got a backlog. It's taking us 21 days to add these numbers. So please don't look at this and say, oh, hospitalizations are going down, because we are not certain that that is a fact. And you can see how this plays out in the other types too. This is the cases with an unexpected error has occurred. That's hilarious. So these are the cases, and you can see that the grayed out line here, sort of the light gray line, it's not anywhere near the number of days that are in the hospitalizations. And in fact, the death numbers, they're not even grayed out at all. So they're much more, although they have as you can see, the 7-day average terminates at about the June 24th, they still don't have any grayed out numbers. So they're a little bit more positive, or at least confident, about the death numbers. Now I'm going to stop sharing one more time and move to another screen. And this is back to AZDHS. And this is what I'm talking about. First, you're looking at the AZDHS's hospitalization. They don't provide any indication as to what their lag is. So when you look at their sort of hospitalization graphs, what we just saw in Maricopa counties, they don't have any light gray. So you look at this and you would presume, oh, from June 15th being 96 hospitalizations, look how quickly it's gone down since then. But these numbers are going to increase by a pretty large amount over the next 10, 15, 20 days. So it's not a number you want to rely on. You can see right here that 63,000 of the cases that they have in the system don't have any hospitalization data. Now, a lot of those aren't going to have any hospitalization data, because a lot of those aren't going to require hospitalization, but that still means that there's a large number that haven't been touched yet. So going back to the two charts that we rely on are the hospital bed usage and availability. This is the total hospital census, and this is agnostic to COVID-19. It's just the number of beds occupied in the ICU, 89% as of today, 11% free. Inpatient, which is just acute care beds, any other bed that's not a maternity bed or a specialized bed, that's 84% to 16%. And then you can see how these numbers have shifted over time. And then we go to the hospital COVID-19 specific metrics, and this shows you the number of probable, as you can see, positive or suspected inpatient COVID-19 patients. So the hospital systems all collectively say that about 3,200 COVID-19 suspected or positive people are being cared for in acute care beds. And on the ICU, that number is 839. These numbers, you can see, have increased. This number is now over 50% of available ICU bed space. So, and again, this is licensed bed space. We're not actually talking about surge capacity. So we just don't know when they add surge capacity, we don't know what that's going to look like, but that's where we are right now.
So if I were looking for the best number out there and I was concerned about this 21-day delay, where would I go to find that information?
So I would go to the azdhs.gov and look at these hospital-specific metrics. We do not have these county by county. I wish we did, but we don't, because this is hospital systems and not counties reporting this data. But this is the best and most accurate snapshot of what's happening. As you can see, when you look at the inpatient, The increase sort of started. There was a low on June 8th, and then this slope is a very steep slope. But as you can see on 26th of June, the slope sort of started to at least decrease its aggressiveness. It's not going up by the same number. It's still going up. It's obviously still has an upward trend, but the slope is a little less aggressive after June 26th. This is a very, I mean, it's not a great sign, but it's still a good sign that at least the hospitalizations started to slow down. Unfortunately, in inpatient, as you can see, the ICU numbers don't have the same trend right now. They're actually going up at a pretty faster clip right now.
Yeah, it's all the numbers that we look at each and every single day as we go through some of this. Okay, so once again, for the people who are just joining us a little bit late, tomorrow is going to be a very telling day, but don't be overwhelmed when you see perhaps super high numbers. That those need to be looked at maybe over a week or over a couple of weeks, and then we'll help walk you through them and compare them, because Garrett, a lot of places are going to be reporting once again after taking the weekend off or having a slow reporting happening on the weekend.
Yeah, I mean, the death numbers that are going to be reported over tomorrow and the next day are not a 24-hour reporting period. They're going to be more reflective of what happened in the last 3 to 5 days.
Yeah, so something to watch. Any other things that you were tracking closely? I see more questions coming up. I see a few more popping up. We'll get to those, but so many different things that we wanted to talk about today. We talked about that census reporter site. I just want to mention once again, it's censusreporter.org to find some really great numbers for people who are looking to
yeah, no space in that, just censusreporter.org.
Yeah, for people who are looking to put all of this in perspective. Anything else, Garrett, that you wanted to touch on? I see you're on the page of the percentages. How did we end up last week for the percent of tests there?
So on the diagnostic test last week, right, or at least June 21st, we're at 21% right now. And on June 28th, which was last week, we're at 22%. But as you can see, there's going to be a lot more tests added to this week than what we've seen. Right now, there's only about there's only a 1 point difference between the two. We sort of want to see that because you can see out here, we have a 4-point increase that from week to week, a 3-point increase from week to week, and right now it's only a 1-point increase. So we want to see this next sort of increase right here to, we want to see that not go up by 2-3 points. So hopefully we're starting to see some signs that at least the percent positive is not continuing to go up. It's starting to level off. Now that could be taken as good news, but it could also be taken that we're at a maximum capacity in test processing. So you just kind of have to look at it both ways, and it's going to take a little bit of time to suss out which way is actually correct.
Yeah, an interesting factor in all that. Leave that page up for one more second. For people who are watching maybe on your cell phone and that's too hard to see, the first section is the PCR test. That's the diagnostic tests.
Yes.
Where you've heard of the swab up your nose. That is what that is. Total percent of positive COVID-19 PCR tests. And then the one below it is the serology test. The serology tests are like the antibody test.
Yes.
And it makes up a smaller percentage overall of the tests that are used, but also of the reporting numbers that are coming in.
Yes, correct.
So
if you want to look at these, if you want to, you can look at these by day. So, and you can see what they look like by day.
Yeah, and we can see the weekends kind of drop off there as well, Garrett. That gives us an even better perspective. Okay, we've had a very interesting question on here a couple of times, and I kind of want to put it all into one question for you, Garrett. When we look ahead at some of these modeling datas that are coming in, these projections, and they're just projections at this point, where do things work or look rather on August 17th, when most places are thinking that is the aspirational date for going back to school here in the state? Are there any modeling systems that break down that we could slide that banner over for folks to August 17th to sort of see what numbers might we be seeing around that time, and that mentally we need to get ready for as we possibly send kids back into the building?
So I'm gonna share my screen here. I'm gonna take you to my favorite model, the one that I think is the most accurate, and this is COVID-19 projections.com/US-AZ right there. This is a model by an MIT computer scientist that uses machine learning to do all this, and the reason I like it is because it's machine learning. You don't have as many variables to play with, and so it's been quite accurate. So to look at that, this is sort of where we are on the modeling. This is the deaths per day. It presumes that right now it's presuming that we could have a peak of about 56 deaths per day on August 4th, but at that point it should start to level off and go down. This is the R naught estimate. What we want to see is this R naught estimate going to under 1. So it's still continuing to drop, and we want this to go under 1. And then
and Garrett, as you roll through that, I want to pause really quick and remind folks, this is the metric that the governor is watching as well, as he's helping to make decisions about this. So he mentioned that in the last news conference, that R naught factor that he personally is watching very closely. So if you want to see how close your kids are to being able to be back in a building to go back to school, that's one of the metrics that he said in his news conference that he's watching. And that can be found on this site that Garrett's showing you. So jot down that address or save it in your toolbar up at the top so you can jump to it easily.
And now on the question as far as August 17th, now just so you know, I'm just a quick show on how to read a model. So on this, you can see there's this sort of shaded blue area. So this is where it says, when it gives, all models give an upper range and a lower range. That's the modeler saying, I'm confident within 95% that whatever happens, it's going to be within that upper range model and that lower range model. And when I look at what is the mean of what I think is going to happen, that's that dotted line. So when we go to August 17th, it's thinking that we're looking at about 13,366 newly infected at the time. We're at about 16,000 right now. And then, excuse me, this is the currently infected. So this is taking out any recoveries, anything else. It's thinking that about 221,000 people will be infected, with an upper range of about 477,000 and a lower range of 90,000. And then this is just the total infected over time. And you can see it thinks that and this, when the total infected, this is an estimate that is people. This has nothing to do with testing. This is its estimate of actually what the community infection looks like at this time, who has had COVID-19 over this time without independent of testing or anything else. And it thinks that about anywhere from 2 million to 670,000 Arizonans, 1.2 million in the middle, 1.3 million have had coronavirus by August 17th. But you can see by August 17th, we're starting to see numbers, at least in this model's projections, starting to go down.
Deb was asking, what's the R naught website? This is the spot that you can see it.
There is another one. Yeah, she's referring to another one as well. There's one called RT Live. And that is
that one too.
That one.
Most of these, Garrett, only go out to October-ish. Is that right? Have you seen any that go out further? And the reason I'm asking is because now a lot of the school districts in Arizona are saying, okay, school's going to start on, let's say, August 3rd. If school's open back up on August 17th, you're welcome to come back. If you don't come back, we're going to have predetermined dates on when you can decide, okay, I'm not coming back for the first one, but I'm going to send my kids back on the second one, which might be November something. Can we drag that toolbar out that far, or do most still currently, as I saw before, stop near October?
So it appears to me that most of the models are using, I'm not an epidemiologist, but my understanding is when you do a model for epidemiology, you take it out 3 months. Okay. So they are adding months as time goes on. So right now it goes on, it's a 90-day forecast. So right now, because it's July, we're looking at October. But as we get into August, it will be going to be much. Sorry, my daughter just stepped in.
That's okay. We'll take my screen full and let you help her for a second. For those of you who are, we'll let him take care of his kids. It is a full-time job bringing this up and taking care of her kids.
So it goes out 90 days. So we're going to by next month it'll go out to November, and then so on and so forth. So that RT Live site, rt.live, it's very simple. This is where you can see what the estimate of all the models are thinking where the R naught number is. So here you are, Arizona. When you consider a bunch of other models, it thinks that our R naught is at 110, which, it's not the highest in the country, but it's still pretty high right now. So
Yeah.
We want to be in places like, as you can see, Connecticut, it's at a 0.75. Illinois is under 1 right now. So we want to be under 1. So that's sort of the goal right now is in the baby steps is get under there. So.
All right. We only have we can talk forever, and we've been talking for 40 minutes, a few minutes left. There was just a question a moment ago on kids who've been affected. It's from Carrie. Carrie writes, how many children in Arizona under the age of 15 have died from COVID-19? How many confirmed cases of children spreading COVID-19 to adults? So what we know at this point, or how this is broken down, is 20 and younger. So we don't have numbers for the age of 15 and lower at this point, I believe, Garrett, right? 20 is the cutoff that we're seeing from the state. Let's show Carrie how to look that up on the AZDHS website.
So we're going again to the AZDHS.gov dashboard, and there's COVID-19 deaths right here. And here is the age groups that they give us. As you can see, under 20 years is the narrowest they give us for this, and there's been 8 deaths in that category. So, and as you can see, the majority of the deaths have come in the 65 plus, which is a very high risk category for COVID-19.
Thank you, Garrett. I hope that helps Carrie to be able to find that answer on there as well. Let's see. I was thinking we have time for a few more questions. Let me scroll through and see. Let's see.
Oh, I see a question about AZDCS CPS.
Okay, let's get to that.
Let me. I have that. Just give me 1 second. It's they do publish numbers. I don't use them that much because they don't update as often as they should. The website is corrections.az.gov/ADCRR-COVID-19-dashboard. I'm going to bring it up right here just so you can see it. This is the corrections data that they give us for COVID-19. And here's all of the different correctional facilities and all the numbers for the inmates. It does give a staff number as well. And you can see they last updated it on July 2nd. But even with those updates, it feels like there's a pretty heavy lag with these numbers as far as how long it takes to them to update these. So even with that update, I'm still sort of cautious about using these numbers for much.
So LJF is saying, thank you so much for posting that. Yay, thank you. We're happy to help you. So any updates on the gyms closing? That is coming from Dorothy. Dorothy, happy to answer. They are in court. They were in court this morning. I think they just got done. Mountainside Fitness was in the courtroom, obviously taking on the state. So I know that we have a reporter working on it. We'll have the very latest coming up tonight at 4, 5, 6, and 10. But that is that's a showdown that's happening right now. So
I see. Sorry. No. LDF is asking about Department of Child, the Department of Child Safety. We don't have any numbers from that. Anything.
Good update. Thank you, Dorothy. You're welcome. So, you talked about the prisons briefly, and one of those items I have posted on my Facebook page as well, if people need more information on sort of why we should all be paying attention to the numbers that are coming out of our prisons as well. And Maricopa County was number 3 on that list. So there's my Facebook address, facebook.com/news from Katie. You can also post a question there, and we'll try to get back to it in our next catch up here with you coming up tomorrow. As long as Garrett and I are both at work, we're jumping on here and trying to answer these questions. All right. Carrie was asking a follow-up question. Can you also answer my other question regarding how many confirmed cases of children spreading COVID-19 to adults? We just don't have where this is coming from. They're still trying to learn so much about this novel virus, this new virus that we're wanting to know that as well. I know so many teachers are wanting to know that, and people who are going right back into our schools. So that's we're trying to get to the answer on that. Ariana's saying, what did she say about the gym? I missed it. They're in court right now. So we'll have even more. Sorry if you were just joining us. Mountainside Fitness is just wrapping up something in the courts with the state, obviously. And so we have a reporter there. In fact, the transcript was just coming down in my email. So somebody was just saying, Rick is saying, I work out in my living room. Rick, I'm with you. I'm out in the garage. I got a cooling system out there, which is just a little box I hook it up to my hose and it just kind of makes it a little bit cooler. And then I go walk outside. So I'm with you. We're trying to stay fit and do so safely in our homes. So, all right. Geez, we could be on here all day, and I wish we could. We've got newscasts to get ready for. So we'll keep your questions coming in. Oh, Ariana, you're so welcome. We will keep tracking your questions and try to get as many answered as we can tomorrow as well. We'll be back here with you about the same time. Remember, all of your coronavirus questions that we didn't get to answer here can also be found at abc15.com/coronavirus. And like I said, we'll have more on our newscast at 4, 5, 6, and 10. Garrett, thank you. Tell your daughter hello.
I will.
All right. Thanks, everybody. Thanks for joining us this afternoon.